Welcome back to the OHSU Effect. Good morning. I'm Lacey Evans. And right now we're going to talk to Shannon Rentz, a registered dietitian with the Knight Cancer Institute at OHSU. Good morning, Shannon.
Good morning.
So explain first what you do and how a dietitian can help cancer patients.
Okay. Well, first of all, thank you for having me on the program. A registered dietitian working with oncology patients. In our department, I work for the Food and Nutrition Services at OHSU, and we work very closely with the Knight Cancer Institute. We have, I'm an outpatient dietitian, the outpatient adult oncology dietitian, but we also have inpatient dietitians, pediatric, inpatient, and outpatient dietitians. So we have a team of 5 or 6 dietitians to help all different areas and needs of our clients.
And stages of cancer, I'm sure.
So oftentimes I will see people even prior or shortly after diagnosis. If they need surgery, I may see them prior to surgery to even get them nutritionally ready for surgery in some cases. I see that our inpatient dietitians happen to see them when they're admitted to the hospital. And then I follow up with them, or our pediatric outpatient dietitians follow up with our patients as needed.
So let's start, I guess, at the very beginning. What are some of the important dietary tips people can use to prevent disease?
Okay, that's a great question because nutrition is so important and people are very interested in nutrition. In general, I have a few suggestions. Really not only to reduce your cancer risk, but to reduce the risk of diabetes, heart disease, hypertension. A lot of the things that I'm going to recommend are going to seem the same because they are.
Mm-hmm.
One of the most important things is to prevent weight gain. This is so important not only for your cancer risk, reducing that, reducing hypertension, cardiovascular, diabetes as well. So, I'm going to talk about some guidelines, which are the same for everyone. You hear the dietitians say all the time, eat more fruits and vegetables. But this is so important. We really encourage a combination of 5 servings of fruits and vegetables a day. And because they have so many nutrients and fibers, it's really important that people try to get their nutrition from food versus taking the dietary supplements.
Well, it seems like we always hear about new studies about what's good for us
Yes.
and what isn't. So are there any new studies that you've noticed recently or that any other doctors up at the Knight Cancer Institute are taking note of?
There was a study about 6 months ago that came out, particularly on the intake of vitamin E, supplemental vitamin E, and prostate cancer. Many people think if a little is good, I'll take more. And in the case of prostate cancer, there was that study that came out in October that encouraged men to avoid taking dietary supplements of vitamin E.
Okay. Well, what about supplements of vitamin D? You mentioned that you would prefer people get it from food or natural, like sunlight, but we lack sunlight so much here in Portland. So do you recommend a supplement for vitamin D, or what are your recommendations there?
Yes, for vitamin D and calcium are dietary supplements that I often recommend. Absolutely. And really in the Pacific Northwest, it's so important. And vitamin D it's not supplemented in food very often. So it's in dairy milk, for instance, has basically 100 international units, and an egg yolk might have 25. So it's not often in our food supply supplemented because it's a fat-soluble vitamin. So I recommend really trying to people get 800 to 1,000 international units of vitamin D a day. And that's difficult to get through food. So a dietary supplement or a calcium with vitamin D is, I think, very important for all of us.
Are there certain cancers where the risk factors have a particularly strong correlation to eating habits?
Yes, there are. And one of the most important risk factors that has a particularly strong correlation, it's related to weight. And there are some cancers. There is some really convincing evidence that body fat increases the risk for cancers, for the following cancers: esophagus, pancreas, colon, rectum, the uterus, endometrium area, kidney, and breast cancer, especially in postmenopausal women. And this is because the fat tends to cause inflammation and insulin resistance that can promote cell growth and cell reproduction, especially people that are more apple-shaped. This can be have really more substances circulating in their blood that stimulate cell division, and often as cells divide, it's more opportunity for a cancer to develop.
Well, let's talk more about what you do up there. You mentioned that you maybe counsel people after diagnosis before they go into surgery or something, but when does a patient typically see you in the course of their treatment?
I often see people sometimes when they're meeting with a medical oncologist that same day in clinic. I often see people, we do an introduction to chemotherapy infusion class, so I meet with people even before they start treatment. I see people in the chemotherapy unit. I see people in radiation. And then I have individual appointments as well that I meet with people to discuss nutrition issues as needed. Follow up. So I see people before, during, and after cancer treatment, as well as people that have the cancer diagnosis is behind them and they're looking for strong survivorship.
Are there dietary considerations for patients on treatments like that could affect their hormones? Is that a factor here?
Absolutely. There's two cancers in particular that have hormone implications.